Now to one of the world's deadliest diseases, which is now forcing Long Beach, California to declare a public health emergency. And this one is about tuberculosis. At least one person there is dead and 9 others are in the hospital because of a tuberculosis outbreak. Yep, the same TB that wiped out millions by the 19th century. Long Beach's health department says that they found 14 cases of the disease at a hotel, but they estimate about 175 people have been exposed to it so far. So TB, we looked into this, and it's been on the rise since 2020. The U.S. reported nearly 10,000 active infections last year alone. NBC News medical contributor Dr. Vin Gupta joins us now. Dr. Gupta, so alarm bells kind of go off when you see one place, a bunch of cases. This hotel where the 14 cases were found, is that like ground zero here?
It is, Gadi. Good evening. This is serious. Tuberculosis, especially tuberculosis, can be anywhere in our body, but tuberculosis, in this case, likely of the lungs, is a big deal because it can spread very rapidly to people, especially individuals who might be homeless or have other risk factors that put them medically higher risk. So it's no surprise to see that there's this focus, this foci of 14 positive cases, multiple exposures amongst this high-risk community.
And how long after an exposure does it take for symptoms to show up? And like, how contagious is it?
Well, it can be very contagious. And so 2 billion people across the world, Gadi, to give you a sense, are actually infected and carry tuberculosis in their body. A very small fraction of that actually experience symptoms and have tuberculosis disease. So tuberculosis infection, you test positive, very common. I think that might surprise some folks. But tuberculosis disease, you actually have symptoms, far less common, less than a few million cases here in the United States. Over the last decade, we've seen about 10,000 cases just this year, 16% rise. So we're seeing an upswing, but it is contagious, very infectious. The problem is who's going to actually demonstrate symptoms. That's where you have to be medically higher risk or have a depressed immune system.
I'm thinking back to the last time I went to the pediatrician. I've got a 6-month at home. We just finished, his battery of vaccines, and tuberculosis wasn't on the list, I don't think. Do we do vaccines for tuberculosis here?
Not really anymore. There is a vaccine termed BCG for short that was given worldwide. To some degree, it's still prevalent, but this is not something that's common here in the United States because it's largely not a problem. Outside of places that are care deserts or in the homeless community, as an example, things to look out for your audience. If you're medically higher risk, may have had an exposure and have had a chronic cough for about 2 weeks, unremitting fevers and night sweats. Those are critical here. Night sweats, a long cough, and a history of an exposure or maybe a travel history, or if you've been recently homeless or otherwise medically higher risk, that's what you want to keep out for. Do you have a relevant travel history or medical history coupled with those symptoms? That's when you want to get tested.
A travel history to LA, which is where we live, along with, millions of other people. Is this one of those things where if you're feeling any of those symptoms, you go to the doctor, you got to tell the doctor, hey, it might be tuberculosis because I saw this thing on the news? Or are doctors around here, or at least in California, going to be pretty wary and say, we're going to test you for tuberculosis?
Usually the symptom profile, a few weeks of a cough with night sweats, that usually gets the alarm bells ringing for anybody, whether or not they've been recently homeless or have a relevant medical history or traveled somewhere where there was a clear exposure. That symptom profile is something that sets off alarm bells. But to your point, Gadi, everybody in the city of Los Angeles is not going to have this exposure. Yes, this is happening in a place, in one facility where we know that there's a group of people that are higher risk. So that makes sense to make sure that we have a high index of suspicion in a patient who might have risk factors for either exposure or infection. That's not everybody in the city of LA. But generally speaking, if you're somebody that has had fevers, night sweats, unintentional weight loss with a cough, that should set any clinician's alarm bells off to at least do the test.
Dr. Vin Gupta, thank you.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.